I hate colon cancer. About 1 year ago, I diagnosed a beautiful young lady in her 30s with colon cancer. Unfortunately, she had metastatic colon cancer, which means that by the time I diagnosed her, the cancer had spread to the entire body, which makes the prognosis terrible and her chance of survival very slim. Thinking back, her cancer could have been diagnosed several years prior if the signs and symptoms were not completely ignored. I diagnosed another beautiful young lady about 3 to 4 months ago who's married with children. She came to me right away after her symptoms occurred, but there were multiple risk factors in her lifestyle which could have been mitigated if she had been educated several years prior. She probably could have prevented colon cancer if she would have been aware of the lifestyle changes that I'm going to discuss with you. March is Colon Cancer Awareness Month, so I am going to dedicate the next several educational videos to colon cancer and teach you how to prevent colon cancer. My goal is to decrease the incidence of colon cancer in the United States and around the world. If you listen to what I have to say, it will be very unlikely that you will ever have colon cancer. According to the American Cancer Society, there are 95,000 new cases of colon cancer diagnosed each year. While genetics play a small role in your chance of getting colon cancer, making just a few dietary changes could be enough to lower your risk of colon cancer drastically. Colon cancer is the number 2 cause of cancer death in both men and women in the United States. But here's the good news. Colon cancer is one of those preventable cancers. There are 2 main strategies to prevent colon cancer: lifestyle and screening. How are we doing in this country as far as colon cancer prevention? Well, unfortunately, we get 2 thumbs down. Although new diagnoses and mortality are decreasing in adults over the age of 50 due to colon cancer screening methods and early detection, there is an increased risk of colon cancer in young adults less than 50 years of age. Lifestyle and diet play an important role in prevention, and we are not doing a great job in this regard as a nation. Approximately only 5 to 10% of colon cancer is hereditary. The major hereditary colon cancer syndromes are Lynch syndrome and familial adenomatous polyposis, or FAP. There are a few other genes that have been implicated in hereditary colon cancer risk, but of course, the majority of the cases are due to environmental causes rather than genetic causes. So what are the symptoms of colon cancer? A change in the bowel habits, rectal bleeding or bleeding per rectum, and abdominal pain. If you are experiencing these symptoms, you should talk to a doctor immediately, regardless of your age and family history. Unfortunately, these symptoms don't present themselves until the late stages of colon cancer. Most people with colon cancer are asymptomatic until the late stages. This is why the United States Task Forces has recommended several different effective screening modalities to prevent colon cancer starting at age 50. And the American Cancer Society recommends that people at average risk of colon cancer start regular screening at age 45. You may qualify for colon cancer screening earlier if you have a family history of colon cancer or polyps, you're African American, have inflammatory bowel disease, and or have familial polyposis syndrome. So what qualifies as family history? Individuals who have a first-degree relative with colorectal cancer or advanced adenomas diagnosed before 60 years of age. First-degree relative just means mom, dad, sibling, and children. And individuals with 2 first-degree relatives diagnosed at any age. These individuals should be advised to start screening colonoscopy at age 40 or 10 years younger than the earliest diagnosis in their family, whichever comes first. Individuals who have a first-degree relative with hereditary non-polyposis colorectal cancer should begin colonoscopy at 25 years of age and repeat colonoscopy every 1 to 2 years. In persons with a family history of adenomatous polyposis syndrome, screening should begin at 10 years of age. Thank you for listening to our first of 4 video series on colon cancer. Stay tuned for the next video, which is about making lifestyle changes and screening methods to prevent colon cancer. Hashtag Dr. Angie Sadeghi, hashtag colon cancer awareness.